Environmental exposures. First, let's cover heat exposure. There's a spectrum of symptoms depending on the severity. When you have a normal core temperature but heat exposure, as well as often dehydration or electrolyte loss, you may present with heat cramps. A more severe heat exposure is heat exhaustion. In this case, your core temperature can be elevated up to 40 degrees C. Patients may present with nausea, headaches, sweating, as well as salt and water loss. The most severe version, if your core temperature gets up above 40 degrees C, is heat stroke. This is fatal if untreated. Patients would present with altered mental status, ataxia, seizures, multi-organ system dysfunction, rhabdomyolysis, and often there's an absence of sweat because the body has lost its regulation abilities. If it's mild heat cramps or even heat exhaustion, the treatment is passive cooling, so spraying the skin, fans, cold packs, as well as repleting the fluids and electrolytes. If the patient has heat stroke, you want to be more aggressive with whole body immersion or big industrial fans and spray coolers, or even sometimes internal lavage. You can give cooled IV fluids and electrolytes, and in very severe cases, when there's impending cardiorespiratory collapse, you could use ECMO. So remember, heat exhaustion or heat cramps, passive cooling measures, repleting IV fluids. If they start to get the body temperature up to close to above 40 degrees C and any seizures, neuro symptoms, altered mental status, then you want to be more aggressive with your cooling measures.